Hey everybody, this is my presentation on my bacteria or my disease that I chose, and I chose bacterial meningitis. So first up, we're going to look at some characteristics of the bacteria that causes it. There are multiple types of meningitis. There's bacterial meningitis, which is what we're going to talk about. There's viral meningitis, and there's even fungal meningitis. But we're going to focus on the bacterial meningitis. So this is caused by the microbe Neisseria meningitidis. So this is a gram-negative diplococci shape. It's sometimes said to be kidney-shaped as well. Here's some examples over here in this picture where the arrows are pointing these little dots over here. That is the bacteria. A couple more characteristics that it has is it's non-spore forming and it's non-modal. So it doesn't have any like flagella or anything like that to help it get around. We'll talk about this later, talk a little bit more about it later, but it primarily moves to the body by the bloodstream. It requires a few specific things in order for it to grow and thrive. It needs an aerobic environment, and it grows best on blood agar, and is also oxidase positive as well as catalase positive. And next, we're going to talk about the symptoms that are associated with bacterial meningitis. So, what bacterial meningitis is it's an infection of the meninges, it's another word for the membranes that surround and protect the spinal cord and the brain. Some of the symptoms that are associated with bacterial meningitis is painful or stiff neck and high fever. Those are the most common symptoms or most well known. You can also experience headaches, lethargy, and confusion, so just being really tired, or it's kind of like fatigue, and also easy bruising as well. If you look in the picture, the bottom picture on the right over here, you can see what the rash that is associated with bacterial meningitis looks like. This is mainly present on like the trunk, the mucous membranes, and your extremities, as you can see in this top picture. There's also some photophobia, which is sensitivity to light, that can be present as well with bacterial meningitis. So next we're going to talk about transmission. So bacterial meningitis is primarily spread person to person through respiratory droplets or by throat secretions. So this picture up top helps show the most common ways that it's spread. So we've got it can be spread by sharing drinks or using like the same straw, fork, spoon. That's a good way for it to spread. Just being in close proximity with somebody who has the disease, that's another way for it to be spread. Being sneezed on or coughed on by someone who's a carrier, as well as kissing someone who is a carrier, and even sharing like an e-cig or a vape or something like that is another way for it to be spread. So basically, touching anything or sharing anything that has someone else's saliva on it is how it's going to be spread. Next, we're going to talk about virulence factors. So it has a few virulence factors that contribute to its pathogenesis. It has a capsule, which helps protect it while it's moving through the bloodstream, and it also helps protect it from phagocytosis, which is a big one. They also have a couple surface adhesive proteins, and what these do is they help bind to the host cells, and it allows it to invade those cells, as well as helping it survive while it's inside the cells. So these are like pili, it's got porins, pore A and B, and it's got the OPA and the OPC adhesion molecules as well. So bacterial meningitis also has something called iron sequestration mechanisms. So what these do is the bacterial cells use this, and they use these to obtain iron from the host cells, machines and stuff, and they use that iron for like basic cellular processes such as DNA replication, transcription, metabolism, stuff like that in order to make energy and stuff. So it also has an endotoxin called lipooligosaccharide, or LOS for short, and this contributes heavily to the inflammatory response in your body. So next we're talking about pathogenesis. So most of the time with bacterial meningitis, the bacterial cells enter the host body by nasopharyngeal colonization. Though this eventually leads to bacteremia, and what that is, it's just the presence of bacteria in the bloodstream, which is how the bacteria moves eventually to the meninges, which is what I was touching on earlier. Excuse me. The capsule that I mentioned earlier also helps it to inhibit neutrophil phagocytosis, so that when the bacteria does make an entrance into the host's body, it can get to where it needs to go without having to worry about the immune system picking up and taking care of it. So through the bloodstream, it travels to the central nervous system, and this is where the toxins and the adhesion molecules come into play. So these toxins and adhesion molecules help increase the permeability of the blood-brain barrier, and this leads to neutrophils and white blood cells entering the subarachnoid space. And when these enter the subarachnoid space, that's what causes a massive inflammatory response. So this leads to the symptoms specific to bacterial meningitis, such as inflammation and cerebral edema. So here's a couple ways that it's diagnosed. So one way is a blood sample is taken, blood cultures are done, just to see if the bacteria is present. It could be placed on a slide and looked at under a microscope and stained as well. Excuse me. Imaging is another way to see if there's an infection. CTs or MRIs of the head may show swelling or inflammation, as well as X-rays or CTs of the chest or even the sinuses may show an infection that may be associated with meningitis. And finally, the most common one, or the most definitive one used, is the spinal tap. So what they do is they collect cerebral spinal fluid. In this top picture you can see they go in at the bottom of the spine and they collect the cerebral spinal fluid, and if you have meningitis, the fluid will show a low sugar level, along with an increased white blood cell count and increased protein count as well. So lastly, we're going to talk about treatment and prevention. So a couple ways to treat it is IV antibiotics. Most commonly used is vancomycin. Corticosteroids are also used as well sometimes, and both of these work just to ensure recovery and reduce the risk of complications such as brain swelling or seizures or something like that. The vancomycin also could sometimes be in combination with some other antibiotics as well, just to make it a little bit stronger. The person's provider may even drain any infected sinuses or mastoids, which is the bones behind the outer ear that connect to the middle ear. And they do this just to try and drain out that infection and all that bacteria and try and get rid of it. So to try and prevent bacterial meningitis, you can keep just a relatively healthy lifestyle and diet. Taking some vitamins is a good way to prevent it too. There's also a vaccine. It's called the meningococcal vaccine, and that helps protect against bacterial meningitis. So in this picture, we can see the recommended ages for the vaccine. The prime time for the vaccine to be given is in the 11 to 12-year-olds range. So that's when they would get their first dose, and then they would get a booster at 16. You can get the vaccine between the ages of 16 all the way up to 25, but doctors prefer that you get it whenever you're between 16 or 18 years old. And adults are also eligible and encouraged to get the vaccine because having some defense against meningitis may be critical in some cases. Even if it is past prime time, it's always a good idea to get that vaccine. And lastly, babies as young as 2 months old can get it, but it's only in certain conditions that they're given a vaccine. Here are my sources, and that is bacterial meningitis.